Selected domain, all domains selected dataset, all records processed, 990. This NeuroGov Plus cockpit is now running as a fully synchronized domain and dataset aware governance cockpit. Every graph, text explanation, query intelligence block, replay intelligence block, seated status, grid, clinical advisory engine, healthcare executive advisory, and Sankey flow is refreshed from the current selection. Runtime interpretation, the cockpit is currently analyzing all domains using all records. KPI, TSI, OSI, RMSE, decision authority verdicts, governance readiness, risk exposure, opportunity index, trained memory signals, assurance view, audit readiness, and board view are all calculated from this same selected slice. Core philosophy, AI thinks rightward arrow, clinician decides rightward arrow, assure proves. Enterprise vision, 1 governance brain rightward arrow, n enterprise domains rightward arrow, n GPTs. Selected domain, all domains selected dataset, all records processed, 990. This NeuroGov Plus cockpit is now running as a fully synchronized domain and dataset aware governance cockpit. Every graph, text explanation, query intelligence block, replay intelligence block, seated status, grid, clinical advisory engine, healthcare executive advisory, and Sankey flow is refreshed from the current selection. Runtime interpretation, the cockpit is currently analyzing all domains using all records. KPI, TSI, OSI, RMSE, decision authority verdicts, governance readiness, risk exposure, opportunity index, trained memory signals, assurance view, audit readiness, and board view are all calculated from this same selected slice. Core philosophy, AI thinks rightward arrow, clinician decides rightward arrow, assure proves. Enterprise vision, 1 governance brain rightward arrow, n enterprise domains rightward arrow, n GPTs. Selected dataset, unseen advanced AI memory status, governance generalization memory. The unseen dataset represents previously unseen records used to verify governance robustness, explainability, assurance integrity, and decision consistency under new conditions. It demonstrates the ability of NeuroGov Plus to maintain governance quality beyond known scenarios. Enterprise memory lifecycle, unseen memory rightward arrow, governance generalization power statement. NeuroGov Plus, advanced AI, enterprise, uses unseen memory to prove governance scalability, resilience, explainability, and enterprise readiness under new operational conditions. AI thinks rightward arrow, clinician decides rightward arrow, assure proves. 1 governance brain rightward arrow, n enterprise domains rightward arrow, n GPTs. Selected domain, healthcare GPT. Selected dataset, unseen records processed, 10 query intelligence for healthcare GPT, management questions, business value, risk impact, executive takeaway, governance readiness, and board context are refreshed from the selected unseen dataset. Healthcare GPT unseen allow management answer for healthcare GPT. This gives management a governed view of intelligence before action. It supports better decisions, stronger controls, and clearer accountability. Business value, improved executive visibility, lower governance duplication, better control over AI-enabled decisions, and scalable domain governance. Risk impact, reduces unmanaged AI decisions, policy gaps, audit weakness, and inconsistent domain practices. Financial impact, Indian rupee, revenue protected, 104 Indian rupees CR risk exposure, 10 Indian rupees CR governance value, 126 Indian rupees CR priority, P5 monitor executive takeaway. Healthcare GPT should use NeuroGov Plus as the trusted bridge from AI insight to governed business action. Management advice for healthcare GPT, prioritize governed actions based on KPI, TSI, OSI, RMSE, and decision authority verdict. Review condition, hold and block items before operational approval. Board advice for healthcare GPT, monitor governance readiness, risk exposure, policy exceptions, and assurance evidence. Use query and replay intelligence for board-level oversight and audit confidence. Domain health assessment, health score 87%. Status, KPI watch, TSI healthy, OSI stable, RMSE acceptable. Suggested advice, continue governance controls, reduce hold and block decisions through policy refinement, improve data quality, monitor RMSE drift, and review governance exceptions. Management action, prioritize improvement items by verdict severity. Board action, track governance readiness and assurance evidence coverage. Patient care readiness score, 87%. Policy readiness 92%. Decision readiness 83%. Assurance readiness 91%. Audit readiness 90%. Overall status, ready. Top risks, 1 policy exception risk. 2 data quality risk. 3 compliance gap risk. 4 prediction drift risk. 5 control weakness risk. Management should first review hold and block records. Top opportunities, 1 improve governed automation. 2 increase allow decisions through better evidence. 3 strengthen policy reuse across domains. 4 improve prediction accuracy. 5 build board-ready assurance reporting. Governance confidence meter, confidence score 87%. Derived from KPI, TSI, OSI, RMSE, Analyzer 1.0 signals, and decision authority verdict. Current status, high confidence. Board dashboard snapshot, governance status green. Risk status green. Policy status green. Assurance status green. Audit status green. Overall board view, green. AI trained memory insight, similar cases found 156. Similar decisions 82. Similar risks 32. Similar policies 16. Recommended action, use trained governance memory, replay evidence, and policy interpretation to guide the next management decision for healthcare GPT. Governance trend, current governance score 87%. Previous governance score 85%. Trust score 92%. Assurance score 91%. Decision quality 85%. Trend status, improving. Conclusion NeuroGov Plus enables healthcare GPT leadership to convert AI output into trusted, governed, auditable, and assured enterprise decisions. Power summary, Domain Healthcare GPT. Governance Health 87%. Top risk prediction drift risk. Top opportunity governed automation and assurance reuse. Recommended action, continue governed deployment with management review of condition, hold, and block items. Board view, ready. Final conclusion, AI thinks, governance decides, assure proves. Selected domain, Healthcare GPT selected dataset, Unseen records processed, 10 executive action prioritization P1, resolved block decisions 24.8 Indian rupees Cr immediate. Highest governance and financial risk. P2, review hold decisions 13.9 Indian rupees Cr 24 hours. Policy exception and management review required. P3, reduce RMSE prediction error 16.0 Indian rupees Cr this week. Improves prediction confidence and reduces error exposure. P4, improve TSI trust score 8.0 Indian rupees Cr this month. Strengthens governance confidence and compliance. P5, improve KPI performance 10.0 Indian rupees Cr planned. Improves business outcome and operating performance. Priority formula, financial impact, Indian rupee, times risk severity times governance criticality times urgency. Management view, do the highest financial and governance risk actions first, instead of reviewing all observations equally. Board view, this gives a clear top 5 action discipline with financial exposure, timeline, and governance accountability.